Thank you all for being here today.
Our rates are 3 times they were before Obamacare started. We have one provider in our county. We have very little options for what we can and cannot do. We're a small business owner. We're actually not a brick and mortar. We are cattle ranchers. We can't afford our equipment if we're paying these rates year after year after year. Our food source is in jeopardy because of this healthcare law.
Every single year, for the past couple of years, I've had a different insurance every single year. Before, I had an individual plan, my wife and I. My wife is an attorney. I'm a computer programmer. I'm a small business. My wife is a small business. And I just don't understand what happened. You know, I have a daughter with a disability. We've changed our plan every year. We
So
changed
your insurance was good before Obamacare.
Oh, absolutely. I never had.
Many people are like that. Many plans were great before Obamacare. They were so happy. And that doesn't justify a system before Obamacare. But people are miserable now, and it's putting people out of business. It's putting them in the poorhouse. Way out of the problem is to do a plan much more like the plan we're going to get done.
With the rising premiums and the rising deductibles, I take care of patients in the hospital, and patients are shocked to get a $20,000 bill and to find that they're responsible for $6,000 of that because their deductible is so high. And that's just a situation that cannot continue. Medicaid expansion under Obamacare really doesn't cover folks either, because many physicians are not even taking Medicare. They're not accepting it any longer in the outpatient setting.
I'm a mom, and I am part of that huge group.
These stories, Mr. President, are really powerful about the consequences of the current law. And you hear people's lives that have been affected in remarkably adverse ways that sometimes you don't think about as it relates to health care. Whether it's businesses that haven't been able to survive, or individuals who need to take 3, 4, 5 jobs, moms that can't be with their kids when they want. This is about real people. It's about real patients. And so working with you and your leadership, we are really excited about the opportunity to put in place a patient-centered system where patients and families and doctors are making decisions and not Washington, D.C.
Thanks, everyone.